The nation's Health and Human Services Secretary is preparing to link everyday Tylenol use during pregnancy to autism. The claim is shaking up medicine and raising questions from doctors who say the science just isn't settled. Here to make sense of it all is Dr. Daniele Fallin. She is the dean at the Emory School of Public Health. Dr. Fallin, welcome to the show.
Thank you so much.
Fallin, I'm saying it wrong. Fallin. All right.
You got it.
So from a public health perspective, how strong or weak is the evidence, scientific evidence, trying to link Tylenol use in pregnancy to autism?
Yeah, well, first I'll say I think it's great that we're bringing attention to research in autism that's not about debunked theories of vaccines and autism. And so I really welcome the conversation around things like acetaminophen and others. But you're right in the way that you said it. Acetaminophen has been studied for many years globally in the autism research community to ask important questions. And what we've seen are originally mixed results, that there were some studies that did actually say, hey, we should look at this further. And then other studies that said, no, I don't see that kind of association. And these are really large studies of hundreds of thousands of kids in some cases, or their pregnant mothers. And what we've seen in more recent studies is that when you do something called a sibling control, that means when you're looking at people who are brother and sister or some combination of siblings, you now have matched on sort of their genetic background and on their experiences within their family and their mother, the actual mother herself. And so when you do that, you can remove some of the other explanations that might be driving a kind of spurious association between acetaminophen and autism. And so when you do that, you no longer see that kind of association. So for me, that means we still have some more work to do because even that's not definitive, but it reassures me that if you're using acetaminophen appropriately during pregnancy and with the guidance of your doctor or care provider, that it should be safe.
So I'm hearing you saying that there's some links that say, yeah, this could be the case, and then there's some that say no links, right? And I guess the no links probably outweigh the smaller links. But when you hear about those smaller links, should that raise a red flag?
I think it's important to always pay attention and be open-minded about new research and then look for the rigorous detail. And in this case, when we look for the rigorous detail, the evidence so far leans to no association. But I think it's important that we continue to study this and many other factors.
Yeah. Are there alternatives for pain relief, fever relief during pregnancy? Is there other things that we should be looking toward?
I'm not an obstetrician, so I wouldn't dare give that kind of medical advice to folks. But
Wise.
I would say talk to your care provider if you are experiencing fever, pain, other things during pregnancy so that you can get the very best care possible for yourself and for your coming child. Is
that the advice you would give to pregnant mothers watching and hearing about this debate?
What I would say to pregnant mothers watching is, please don't take this on as yet another thing that we put as burden on ourselves when we're carrying children. This is not about blaming the mother. This is about arming us with the best information to have the healthiest pregnancies. And so talking with your doctor and leaning into evidence-based findings is the best thing you can do for yourself and for your child.
When you hear statements like this from high-profile figures like the nation's health secretary, it has an effect, or do you think it has an effect on public trust when it comes to medical guidance?
I do worry about that, and I hope that we continue here at the Rollins School of Public Health and at federal agencies and many other places to provide trusted information so that we can help folks make the best decisions possible.
Dr. Fallin, what is the single most important takeaway you want folks out there to remember about Tylenol use and the autism risk?
That the evidence is mixed and too soon to make any changes in our guidance.
All right, there you go. Dr. Daniele Fallin, thanks so much for joining us. Thanks so much for your insight. Really appreciate it.